Remote Patient Monitoring, or RPM, is a telehealth option designed for patients with acute and chronic conditions requiring ongoing monitoring. It allows healthcare professionals to collect and analyze patient health data between appointments using FDA-approved devices. Typical measurements include blood pressure, weight, and blood glucose levels. Let's walk through the essential guidelines set by the Centers for Medicare and Medicaid Services, or CMS, for successful RPM implementation. The initiating visit. Before commencing RPM services, there must be an initiating visit for new patients or those who haven't been seen by the billing provider within the last year. This visit can occur during a face-to-face evaluation and management visit, or E&M visit, annual wellness visit, or AWV, or initial preventative physical exam, or IPPE. Remember, if RPM isn't discussed during these visits, they can't count as the initiating visit. Patient consent. It's crucial to obtain the patient's consent, written or verbal, before billing for RPM services. Patients only need to provide consent once unless they switch to a different RPM practitioner. This ensures patient engagement, clarifies cost-sharing responsibilities, and prevents duplicate billing. Device setup and supply. The RPM device used to collect and transmit the data must meet the definition of a medical device as defined by the FDA. According to the FDA, a remote patient monitoring device is something that 1. Measures or detects basic body functions without invading the body. 2. Sends this information wirelessly to the patient's healthcare provider or another monitoring group. When supplying the qualified device, it's crucial to educate the patient on how to use the equipment. 16 days of reading. Remote physiologic monitoring data must be collected for at least 16 days out of 30 days. Documentation. Accurate documentation of the time spent on remote monitoring activities and the data collected is essential for billing purposes. This documentation should be maintained in the patient's medical record. Compliance with billing codes. Understanding and utilizing CPT billing codes is crucial for reimbursement and improved patient care. Billing codes are based on device supply and setup, number of readings, and time spent on education or intervention. Lastly, let's discuss the expectations for care managers. Care managers in RPM programs have critical responsibilities, including device setup and training, patient education, data monitoring, communication, care coordination, documentation, and compliance. By meeting these expectations, care managers can effectively support patients in RPM programs, improve health outcomes, and enhance the quality of care delivery. In conclusion, understanding RPM program requirements is essential for successful implementation. By adhering to guidelines and leveraging your knowledge, you can provide high-quality care to patients enrolled in RPM and improve their health outcomes in the process.